Welcome, welcome. This is Dr. Sellars Educate. Super excited to have you here tuning into my YouTube channel. Very thrilled to say this is my first YouTube publication. So let's jump right in. This is the Certified Nurse Educator review. I'm going to give you everything you need to pass your certification exam. That's right, I am Dr. Sellars Educate, and I am a Certified Nurse Educator, only taking the CNE one time, and that is what's going to happen for you. This is session 1. We are going to do an introduction to the CNE exam. We are going to do an overview of exactly what you can expect as you start on your journey. And finally, we're going to wrap up with Competency 1. So sit back, take some deep breaths. We're going to get through this step by step. I'm right here with you every step of the way. Also, to let you know, there are sequential sessions that you can also capture right here on the Dr. Sellars Educate channel. Let's jump in. Welcome. This course is going to give you, again, everything you need, so no worries. We're going to move past this slide and just get into the details. We know CNE is a mark of professionalism, and that's why you're here, right? Course objectives. Every good nurse educator has to have objectives. Here we are. You are going to be introduced to the CNE exam. We're going to identify the next steps in the process and wrap up by talking about future sessions to help you plan your path. Look at the candidate handbook and the option for a self-assessment exam. You also have prep resources, and there are several resources as listed here that you can decide for yourself if you want to purchase. There are NLM practice exams as well as the CNE review book, which I highly, highly recommend. You know, I got to tell you, this really was my Bible as I was on my journey last year this time and looking at how I could be successful the first time. There are also review courses. You're attending the first session 1 free right here. And this is my way to give back as a certified nurse educator to the next generation that wishes to achieve this important mark of professionalism and validation of competency. Success coaching is also something that I offer. Here, what I offer is $129 because I appreciate you all tuning into this channel. Again, it's optional. If you are interested in group coaching, I'm happy to talk through that as well. You can just pop over to drsellarseducate@gmail.com and send me an email. I'll be happy to discuss options with you, okay? The other big investment, which is not on here in detail, but it is your time, right? You're spending a lot of time investing in achieving your success because that's what's going to happen as long as you stay right here with Dr. Sellars Educate. Spending a lot of time in investing towards a successful certification. The exam cost is $500 you will need to pay, or $400 if you're an NLM member. And why is this such an important point to make? Well, because only 60 to 70% of students pass. That's the pass rate that NLN is reporting right now, okay? I want you to be in that 6 to 7 out of 10. What they don't tell us is if this is a first-time pass rate or second. I gotta tell you, I'm gonna be real honest. I have spoken with many educators over the years who have never passed the CNE, but that's not going to be you, right? Because you're here. You're going to tune in to Dr. Sellars Educate. If you're watching through the YouTube channel, go ahead and subscribe right now because I will be posting more of these sessions right here for you to review for absolutely, again, free. It's a way for me to give back. I'm all about being a servant leader, and I want you to be successful just as I was. So make sure that you are considering this and all of these investment options as part of your journey. And it's worth it, right? You want to invest your time and your energy and your money into success for the first time. We want you to be successful so you can move on your journey, whatever that may look like. So speaking of the journey, this outlines all 8 review sessions. There will be some sequential repeating. Go ahead and head over to my Eventbrite invitation, and you can see exactly what that schedule looks like. feel free to reach out at drsellarseducate@gmail.com if you have questions about the schedule, or if none of them really work for you, that's okay. We can talk through a strategy to make sure you get the information you need as you move forward. Just to do a high-level overview, because I'm not going to spend too much of your time focusing on this, because I know you'll be joining me for all of these sessions either live, or if you're watching on my YouTube channel, you'll be back to catch them that way. Session 1 is what we're doing today. Session 2, as well as the sequential sessions, will focus on a competency per session. So we will hone in on some of those key concepts associated with each of these competencies to get you ready to pass the CNE exam. Some competencies you will be stronger in than others, and that's fine. Getting started is part of the process of helping you overcome your fears and move forward, looking at each competency for each session so that you can identify those knowledge gaps and figure out how to close them. Now, we will talk about strategies that you can use to help close those gaps, and I'm always available to answer questions that you may have, again, at drsellarseducate@gmail.com. Additional resources, NLN website. It's an excellent free resource to get you started. Hopefully you've already been there, but if not, you want to go ahead and check out NLN website. I recommend that you download that candidate handbook. It's going to have extremely valuable information in there as it relates to the eligibility, the exam prep, fees, and other important details that you will need to know. Again, you will need to know exactly what's in that handbook. Remember, everything is free game, okay? So I'll go ahead and give you a little secret. The section about professionalism and why CNE is so important, there could very well be questions on the exam associated with that criteria and those guidelines, okay? So don't take anything for granted. I believe the handbook is about 30 or 40 pages. Don't take it for granted. Read over it. Make sure you understand all of the components associated with the CNE. It's going to better equip you to be successful on that exam, okay? Test blueprint. There are 2 different levels of the blueprint. There's a very generic overview, which we're going to talk about shortly. And then there's a more detailed one. All right, so I need you to make sure you review the detailed test blueprint, okay? That is your guide as you are marching through each of your steps in the review process. Remember, there are 5 steps, right? Like we talked about initially on the course objectives slide. There are 5 steps to success in my process. The first one is your commitment level, right? And you started your commitment with this session 1 video. So congratulations to you. That's awesome. You have completed step 1. Congratulations. Step 2 is for you to look at different resources and commit to purchasing the review guide, right? The NLN Certified Nurse Educator Review Book by Linda Caputi. It is a must-have, right? It's a non-negotiable. Remember, I said I've treated it like a Bible. The third step, close those gaps. So you're going to be reviewing the handbook, reviewing all of the free sample questions and practice questions, which, by the way, if I wasn't clear, the CNE review book has practice questions in every single section, and it has the answers at the end. So take advantage of these excellent resources that you have. Remember, the review book is published by NLN. And I got to tell you, if you purchase this review book and you follow all of the key components and understand the concepts, the practice questions, you follow everything I'm telling you right here, you're going to be successful. Okay, so no stress. You're on this journey. I'm right here with you. Make sure you get this blueprint. That's step 3, is identifying those gaps. Step 4, you're going to go ahead and apply to take the CNE exam. Yes, you will be ready. We are going to move forward on this journey, and you're going to go as quick or as slow as you like, which is the beauty of having the one-on-one time with me right here on my YouTube channel, or however you're accessing this information, right? There are multiple streams that I have posted this information on. And step 5 is, that's right, you're going to be successful at passing the CNE. You're going to pop an email over to me and just tell me about how great how well you were prepared and how great you did on the exam. So practice questions, let's get back here. There are specific sample questions on pages 12 and 13 of the Candidate Handbook. You're going to see some peppered throughout this presentation, but do take the time to go back and look at these questions for yourself and take notes. I recommend printing out that handbook. It includes this test blueprint, which is going to guide you. This is a high-level overview. Like I said, there's 2 sections. This is one of them. This gives you a breakdown of the % of exams that is included in each of the categories or competencies. However, there is a more detailed blueprint that I want you to look at in your Candidate Handbook. The exam is only 150 questions. 20 are unscored. We have no idea which ones are unscored, but you're going to get your certificate of completion, right? So there's no need to focus on or worry about, which of the questions are going to be uncounted. You just need to breathe. So go ahead, take a deep breath right now, because you're going to do this. You have everything you need to be successful. So let's jump in. As we talk about competency 1, it is facilitation of learning. 22% of the exam really hones in on learning styles, learning objectives, and facilitation of learning. Learning styles, you want to make sure, and I'm going to refer back to our resources, primarily the ones I am recommending are, again, the CNE Review Book, the Teaching and Nursing Textbook by Billings and Halstead, and then there's another resource I like to recommend to my learners, and it's called the NLN Core Competencies for Nurse Educators, and it is by Judith Halstead. The 2 resources by Halstead and Caputi are listed in the Candidate Handbook as resources. You will see in your handbook, they provide an excellent list of resources. However, I wouldn't spend a whole lot of my time looking at the plethora of resources that are listed in the handbook. Simply stated, dig deep into the 3 resources that I've shared with you. If you have questions about the resources, pop me an email at drsellarseducate@gmail.com. I'll be happy to provide the link to you and more information. So going back to learning styles, if you take a look at Billings and Halstead, the specific learning styles are highlighted in that textbook. That's why I love these resources so much. There are no surprises on the CNE exam. I got to be honest with you, if you just take the time to read over these topic areas and do your due diligence in looking at the learning styles and what they all mean in Bloom's taxonomy, you will do fantastic on the exam. Learning styles in the CNE Review Book is actually on page 3. It is chapter 1. It talks about the VARC method specifically, but there are other examples of learning styles that are captured in the review book as well as in the textbook. Nursing theory, I have to be honest and say theory is my passion. What I really like about theory, I think, is that it helps me understand the why. I've always been one of those nurses that wanted to better understand the rationale that helped me provide better clinical care, but also explain to my patients and families why. That is one of the most embarrassing things, is to do something to your patient or with your patient and they say, well, why do you do it that way, and not know, right? So we want to know. We want to know exactly the why, and that's what evidence-based practice and nursing theory provides us. Appendix A, you see in the CNE Review Book. Remember I told you how awesome this review book is? I'm actually sitting with the review book in front of me as we talk today. So Appendix A, which starts on page 141, it talks about some of the key educational learning theorists. You want to tune in there, take some time to dig deep into that, make sure you understand nursing theory, and most importantly, how it applies to Bloom's taxonomy, how we can implement teaching strategies into the classroom to immerse students onto the or within the cognitive domain so that they reach the highest level, which again, remember, is, that's right, creating. One great example that I use with my learners are concept maps. Concept maps fall on the highest level of Bloom's taxonomy. So we want to make sure that we are immersing our students at the highest level possible on Bloom's taxonomy, okay? Learning objectives, student-centered. Some educators can get a little anxious about that term. We're going to talk a little bit more about that shortly, so let's keep going. We want to make sure as educators that we're providing timely feedback to our students. That's really important. We want to encourage active student participation. Highlight learning, structured and unstructured. Students need both. Make sure you're including those in your objectives. We are practicing in a setting where there are multi-generational, multicultural, and gender influences that really shape our learning and our teaching styles. So just be mindful of that as you are reading over concepts and ensuring that you are able to break these concepts down in a way that you understand first and foremost, and second of all, that you'll be able to capture or reflect on when you pass your exam. Leveling up, that's why you are here. You want to take your learning to the next level. You want to validate that you are a professional nurse educator and that you are highly competent. So what are these educator attributes that we're talking about? This is a focal area, and if you take a look at the detailed blueprint in your candidate handbook, you would see that there is mention of educator attributes and what that all means. Well, this is it. This is a very busy slide. I'll go ahead and tell you I'm not a fan of having a lot of content on a slide, but because I want to equip you with the most knowledge that I possibly can, there is quite a bit of content here. But here's the good news. I'm not going to read it to you, right? Because all of you can read and are competent and knowledgeable and skillful educators. So I don't need to read this to you, but just be reminded that these are key concepts that may seem basic, but it's important for you to understand every single one of them, how they are described in your textbooks and in your review manual, and then understanding on that detailed candidate blueprint how you may see them and how they may show up in the exam. So it's game on. Everything is free game that we have talked about and will continue to talk about during this time. Implementing a variety of teaching strategies. That is so important. And let me tell you why. We see so many different learning needs and learning styles and life experiences that are bringing students into the classroom for a variety of reasons. And so it's important for us as educators to understand how valuable it is to engage in case studies, concept maps, learning circles, all of these high impact practices to actively engage our students through the learning process. There are lots of delivery methods too. You want to immerse students in all of them, especially the remote learners, right? So you need to consider the type of delivery that you are providing your students with. Simulation. I got to tell you, that's been our saving grace in the academic setting when it comes to these challenging times of COVID-19. We know that there are social physical distancing requirements that every single state is being forced to uphold. So what does that mean? Well, it means the students may not get those clinical placements, right? That is a core component of clinical application. The NLM review book on page 5 talks about setting a method of delivery. You need to, as an educator, understand how important these delivery methods are and how they can influence and shape your teaching strategies in the classroom. Again, you want to make sure there are a variety of offerings in your classroom so that your students stay engaged in the learning process, and most importantly for the exam, that you understand the why. So slay the day, right? You are going to slay your CNE exam. You are still with me, and hopefully you're taking really good notes. This is another busy slide. We're not going to go over it in detail because, again, you know how to read. You want to take some of these concepts from this slide, these teaching strategies, these high impact practices, and just do a self-assessment. How much do you know about the constructivist learning theory, if I can get it out? How much do you know about it? How much do you know about behaviorism? All of these learning theories are listed in Appendix A and also in the Billings and Halstead. There's a lot of discussion about theory. So take a look at those resources. You are a goal-getter. You are going to nail your CNE exam. So don't be timid. I don't want you to be overwhelmed because we've talked about so much. Let's jump into another test question. I just want to make sure you're still with me. This is directly from your CNE review book. So here we go. Which student role has been shown to be least effective for students while practicing nursing in a clinical simulation environment? Now, if simulation is not an area of expertise for you, it's okay. It's a gap, right? It's a gap that we're going to close together. Take a look in your review book on page 7. There is a section called Simulation Context. There are, depending on the literature you look at, there are several roles associated with a clinical simulation. We're going to talk about, or this question, I should say, lists 4 roles, but primarily I'm going to talk about 3, which include the documentation nurse role, the actual caregiver role or the nursing role, and third is the observer role. The observer role is the least effective for students, and hopefully that's the one that you answered. And why would that be, right? Why would the observer role not be as effective? Well, I'm glad you asked me that question. The reason why is because out of this list, we know that there is possibly some two-way learning that might occur with each of these roles, except for the observer role because it's passive, right? You're just watching. The documentation nurse role, there's an assumption, and I know what happens when we assume, but this is a fair question that could be on your exam. The documentation nurse role, they're just taking in information and writing it down. However, there's probably some translation of knowledge or inference of knowledge that will occur as the nurse scribes, if you will. Family member, there certainly may be some dialogue between the caregiver or the nurse in the role, the simulation role. Patient role, there may absolutely be learning, but that observer role, all they're doing is just watching, right? So it's passive learning. It's not active learning. I know it's a question that may not feel fair to all of you, but for purposes of the CNE exam, that would be the least effective role in simulation. Make sure you take time to look at the standards associated with simulation if you want to dig deeper to help you better understand simulation and formative and summative assessment, which are key components associated with simulation. All right, next steps. You're getting ready to cross the finish line for session 1. I hope this hasn't been too in-depth for you. But after today, you're going to purchase your resources we talked about. Go ahead and start those practice tests, your study plan. Think about our session for this time and schedule your session 2. You can always email me, as I said, to talk more about next steps for you. If you're not clear on anything, just know you can and you will be successful on the CNE exam. I am here to support you, drsellarseducate@gmail.com, every step of the way. I have all the confidence in each of you, and I am here to support you. And I want to take just a moment to say thank you. Thank you for your time. Thank you for your passion and commitment to lifelong learning. I know that if you did not have a passion, you would not be here. And I know this is time out of your day, right? Wherever you may be in the world, in the country, this is time that you've spent for self, right? To focus on how you can get better and take the next step on your nursing education journey. So again, I am Dr. Sellars Educate@gmail.com. Feel free to reach out. Blessings to you, your coworkers that you work with. Thank you for your service as clinicians, as educators, as experts in our industry. Nursing education is a specialty, and you are well on your way to and your journey to validating that. All the best. See you soon.